Hi, my name is Eleanor Shaw, and today I'm going to be discussing infection control. This course is designed for LPN students who have already finished the nursing curriculum. However, if you're using this as supplemental material while you're in nursing school, that is also acceptable. So, infection control is a set of standards and practices that we use to decrease or prevent the spread of infections in healthcare settings. Implementing infection control not only protects ourselves, but it protects the patients and the visitors who come in to the healthcare facilities by minimizing the risk of exposure. Everybody gets standard precautions. Standard precautions can include hand washing, use of personal protective equipment such as gloves, touching body fluids, wearing gowns, goggles if we're going to get splashed, respiratory hygiene, covering our cough with our arm, or wearing a surgical mask. Safety injection practices, including using safety device needles. Proper cleaning of rooms, so having environmental services come in and clean or cleaning them ourselves prior to letting a new patient in. So the first one up is contact precautions, and that is an infection that is spread by direct contact with patient or indirect contact by the patient's belongings. Diseases could include MRSA, VRE, C. diff. And remember that C. diff requires us to wash our hands. Hand sanitizer will not kill the spores. That being said, it's very important that we also know the full name of these diseases, as the NCLEX can test to you using both. Scabies, lice, RSV is the only one that requires two types of isolation, contact and droplet. Herpes simplex if the lesions are open, wounds that are draining that are not covered by a dressing. Impetigo, norovirus, or rotavirus are also common contact diseases. So here are some things that we have to wear in the room: wash our hands, gown and gloves, and make sure we remove them prior to leaving. Droplet precautions is used for pathogens spread by large respiratory droplets that travel short distances, about 3 to 6 feet. These patients can have the door open. Contact patients can have the door open. Both of these patients can also have roommates as long as the roommate has the same illness. So for this, common diseases include all flu, influenza, whooping cough, mumps, rubella, meningitis, diphtheria, RSV, parvovirus 19, pneumonia, and that's especially common in young children. So when we're thinking about droplet precautions, just know that droplet precautions are most infectious childhood illnesses. So for droplet precautions, clean hands, wearing a surgical mask, eye protection if we're going to get splashed or if we have to suction. So gown, gloves are common. So we carry it through, all the way through our contact precautions. Airborne precautions. Diseases spread through airborne particles that remain suspended in the air and travel long distances. These patients need their room to be closed. These patients need what's called a negative pressure room. This room has ventilation that flows outside of the facility, and the air is not recirculated to the general public. Common diseases include TB, rubeola, which is also called measles, not to get confused with rubella, that's listed as a droplet precaution. Chicken pox, all the pox, so smallpox included. Disseminated herpes. So what are we wearing in the room? An N95, not to be confused with the surgical mask for droplet. And again, we would wear the gown and gloves, a face shield if we were going to get splashed or had to suction the patient. So you can look at this on your own. So why do you think infection control is so important? It's important because it mitigates the risk of you and I, our patients and visitors, getting sick. What's one thing you learned from this? So pause and reflect. And how can you bring this information back to the nursing practice? If you need additional resources, I have a cheat sheet here for you. I also have a video that you can watch if that's the way that you learn, by seeing it. And now we're going to test our knowledge. You'll click this button here. It'll bring you to a quiz. After you take the quiz, screenshot your results. You have to get 10 questions correct, or 100%, in order to get a certificate of completion for this course. If you have any questions or you need anything from me, feel free to reach out. My email is Eleanor, Eleanor, Shaw, SHAW, 2747 @gmail.com.